Great. All right, so good afternoon, everyone. Let's just go ahead and get started. This is Keisha Pollack from the PAPRN Plus Coordinating Center. Thanks to everybody for making time today to be on this call. Let me extend a great big welcome. We haven't spoken in a bit. We canceled our last call because we learned that there were a few conflicts and we were projected to have low attendance. And so I hope folks appreciated that we postponed a great presentation we were going to hear about engaging with policymakers, and we're seeking another date in the future to bring that to the network. So today we will begin as we normally do with updates from the CDC. So let me turn it over to Tom to provide those. Tom, are you on the line? Hello, Tom?
Hello.
Hi, everyone. This is Keisha Pollack. If you can please mute your line, please. Thanks so much. I thought I heard Tom talk, but maybe I didn't. We'll just wait a minute and move right on to the coordinating center updates, and we can come back for CDC updates from Tom Schmidt and anybody else from the CDC. So as far as the coordinating center, we are in the process of setting up presenters for the next several calls over the next few months. If you're interested in presenting your work, please let us know. We are at the point where we are highlighting the collaborating centers research projects as they are in year 3 now, and several people have asked for some updates, and so we're excited to have our first presentation from one of the funded collaborating centers in a little while on this call. I also want to provide a brief update. On our last call, I mentioned that we were writing a paper that grew out of the NIH-supported meeting we had on dissemination and implementation of policies to promote walking and walkability. Many thanks to individuals from the working groups who helped provide draft language of that paper. So that draft will be going back out to all of those who contributed to help refine and provide edits. And I just want to say we're excited for this because I think it'll be an important paper for the field, where we are identifying for each of the working group topics where are opportunities to advance policies to promote walking and walkability using a dissemination implementation research framework. So we're excited about that, and whenever we move that forward and are able to share it, we will certainly do that. And I think it would be good to highlight sort of what we found on a future call, so we'll be sure to do that. That is my only sort of update right now. Amanda's going to provide a couple of updates on the working groups, and then we'll circle back and see if Tom has joined the call. So Amanda, please.
Great, thanks, Keisha. I just wanted to give a brief update on the working groups. I think most people are familiar with what those are, but we have several different groups based on topic areas. So we have Parks and Recreation, Complete Streets, older adults, and we're actually thinking of expanding that group to older adults and people with disabilities, rural physical activity, and also school wellness. We partner with the NOPRN group. And I think I missed one. I forget which ones I said now. I think Complete Streets. But so most of those groups are now meeting bi-monthly, and we have quite a few projects going, and we've made some really good progress on some of the kind of research summaries that we're working on. And so I'm hopeful that we'll have some products coming out of the working group soon. So if you are interested and are not already part of a working group, you can just reach out to me and I'll send you the information that you need and also let you know when the calls are going to be. So just another plug to, if you aren't already involved, there are lots of great things happening. So just let me know if you're interested. And the only other update I was going to give is about the Active Living Research Conference. As many of you already know, we're this year excited to partner with the Alberta Center for Active Living, and the conference will be held for the first time in Canada. So we'll be in Banff, Canada, February 11th through 14th. And so we'll have lots of fun winter activities. And the call for abstracts will be released really soon. We're in good shape for our timing. And those will be due on August 24th. So there will be a save the date and theme information going out soon. But in the meantime, just be thinking about what work you're doing that would be good to submit for the Active Living Research Conference. And in the past, we've had several PAPRN focused events there, and we'll plan to do the same thing again this year. And so we like to take advantage of the fact that there are lots of people in person there, and we'll coordinate some networking activities and meetings at that conference. And again, that's February 11th through 14th in Banff, Canada.
Great, thank you, Amanda. Does anybody have a question for me or for Amanda on any of these coordinating center updates? Okay, thank you very much, Amanda. We're excited for ALR again this year. Let me just back up in the agenda. If Tom?
Keisha, I'm on now.
Hey, Tom. Great. So it's perfect timing. So we're turning it on to you for CDC updates.
Okay, I got cut off, so I'm back now. Two things I want to mention. One is called the Healthy Behavior Data Challenge. And as you guys might know, our BRFS and other surveillance systems are being challenged by getting access to the full spectrum of the population. And what the data challenge is doing is basically trying to find ways to collect information other than just through the telephone. The Healthy Behavior Challenge will support the development, implementation of prototypes to use these novel methods and data sources such as wearable devices, mobile apps, and social media to enhance traditional healthy behavior surveillance systems. There's two phases. The first phase is $30,000 prize, but that's divided among 6 teams. And then of those 6 teams, a subset will be invited for the second round, which is goes $70,000, first prize of 40 and on. I think it's the kind of thing that a lot of either you guys or some of your students might be interested in pursuing. The web clip is challenge.gov, challenge the healthy behavior challenge. I'll send you that so you don't have to try to write it down, but it's worth just looking at and pursuing. Unfortunately, it's through CDC, so we're not eligible, but I really want to encourage others to explore it and maybe win a prize.
Great. Thank you, Tom. It does sound like an exciting challenge. I hope people participate. It's a nice incentive.
The other is the sort of the elephant in the room, and that's the budget, the president's budget or our budget. And of course, things change quite a bit if they even look like what's originally proposed. But for CDC, there's some significant rethinking about how funds could be used. Generally, we've been giving funds directly to states under categorical labels such as cardiovascular disease or diabetes. And now they're thinking of expanding what's called the block grant, which would mean states would get a bigger chunk of money that they could then divide up as they and their advocates see is most appropriate. Implications for that block grant and for us are, in order to do that, they would change or zero out some programs such as REACH, also the prevention research centers, the injury prevention centers, and some smaller programs such as epilepsy. Again, these are just proposals. They're not written in stone, and in other years, they haven't even looked like what was initially proposed. But for PAPRN, I think it's worthy of being aware that these are some things that are floating around.
Yeah, thank you, Tom. And through the PRCs, they are organizing hill visits and really encouraging individuals to connect with folks in Congress to really highlight the importance of these funds to improve the health of Americans. And so I encourage folks to connect with their PRC director if they're interested in being involved in those Hill visits to educate staff about the importance of these funds to the PRCs and ultimately to us, to PAPRN Plus and other SIPs.
Yeah, and the injury group is in this time as well, so it's both our chronic disease side and the injury side and other training programs as well. So academics would be hit pretty hard. That's what I've got.
Great, thank you, Tom. Does anybody have any questions for Tom? Oh, actually, Tom, somebody sent me an email asking about year 4 notice of awards for collaborating centers, or are you aware of when those will be sent out?
It's been delayed a bit. I think it's projected for August now.
Okay.
We actually didn't have any money in our pocket, so we had to wait a little bit.
Got it. Okay, so for anybody who was interested in or who had asked that question, we have to wait a little while to get those. All right, let me pause for a second and see if there are any questions on any of the updates before we shift gears and turn to our presentation for today. Okay. All right, so I am thrilled to introduce today's presenter. As I mentioned, we are going to, over the next several months, have a series of presentations from the collaborating centers to present an update on our research. The collaborating centers last presented in year 1, talking about what they are planning to do, and so now it's nice to sort of get an update on findings from the research that's been supported. And today we have Dr. Stephanie Lemon, Professor of Medicine of the Division of Preventive and Behavioral Medicine at the University of Massachusetts in Worcester. Stephanie is also the director of the PRC there, and her research interests are focused on public health approaches and understanding and reducing the obesity epidemic using the social ecological framework. So we are excited to hear from Stephanie, who will present today on work that her and her team have been doing entitled Core Capabilities for Local Health Department Involvement in Land Use and Transportation Policy Processes. I hope people have lots of questions at the end. I think this is going to be a terrific presentation. So let me go to Stephanie.
Thank you, Keisha. Is my screen visible before I get started?
Yep, it is. Looks great. Thank you.
Okay, great. Great. So thank you. I'm really excited to be able to talk about our work today. As Keisha mentioned, we're going to be talking about our core project that we've been working on over the last almost 3 years through PAPRN. But I'm also going to be talking a little bit about some previous work that we had done through the last cycle of PAPRN that led to where we are today. Before I get started, I just want to acknowledge the collaborators who have been working with us on this project. First, Karen Goins is on the line. Karen has been the co-investigator and coordinator of the PAPRN work that we've done over the last 7+ years. And the individuals listed on the screen right now are the folks who've been working with us on our current project. As you can see, we've got folks who are active in PAPRN as well as other colleagues in the realms of transportation, land use and planning, as well as some practitioner-focused, some collaborators. So it's been a really great team to work with through this project. It's going to be a very research and data heavy presentation because I'm interested in sharing results. If people have questions or anything, points of clarification along the way, please feel free to chime in. I'm happy to take questions at any point. And then lastly, the official acknowledgement. As a good academic, I want to acknowledge our funders. We're very grateful to the CDC and to the PAPRN Plus network for funding this work. And I have no disclosures to make otherwise. Very briefly, I'm probably preaching to the choir, but transportation and land use policies, as we know, can promote physical activity. There's quite a bit of observational data that supports this. At this point, there's been a lot of movement towards thinking about, okay, we understand how this works, understand that this is an association, but what can we do to really use policy approaches to promote physical activity in communities? At the local level, even though funding for transportation and land use comes from local, state, national funds and sources, and there are a lot of different ways that funding streams work and that policies happen, much of the work actually happens at the local, municipal, or county level where local decisions are made. Increasingly, local health departments, which come in a variety of shapes and sizes across the country, are being called to participate in these policy processes, particularly in an effort to promote efforts to increase physical activity-friendly policies in communities. However, by and large, this type of training in policy work is not part of a traditional local health department employee skill set. It's not something they have training in. It's also not typically something that is part of their job responsibilities. And so with this very broad context, I'd like to move on to first talk a little bit about what we did in our first funded cycle of PAPRN from 2009 to 2014. Our goal back then was to describe municipal officials' participation in land use and transportation policy, as well as to understand barriers and facilitators to this participation. So we started off with a broad focus at the municipal level beyond public health, but to include all municipal employees, leaders, who may be involved in this kind of work. Our first study was a survey of municipal officials. We utilized the working group structure of PAPRN to conduct a web-based cross-sectional survey that was guided by diffusion of innovation theory. We ended up targeting officials in 8 states that are listed here, and those 8 states were very much a convenience sample because those were the 8 states that we had representation from on our working group. And we targeted larger communities of 50,000 or more and identified communities through municipal yellow books and basically did an inventory of all relevant municipal officials in these states, in these communities, which amounted to about 94 cities. Very briefly, what we found in our final sample of about 453 people were largely white men who were college educated, who fell, sort of in the middle in terms of political affiliation on social issues, but much more on the conservative end of the spectrum on fiscal issues. And the breakdown by participant job position looks like this. So we had a small fraction from public health, a large group of municipal legislators, and then representation from planning, transportation, economic development, parks and recreation, as well as mayors and city managers. To jump ahead to some results, what we found was that in response to our first question about participation in policies related to land use, over 70% had some participation or involvement in this type of activity in the past. And you can see from this slide, it's probably not surprising that everybody who worked in planning had this kind of association, but there was a lot of variability from the other disciplines, and public health really lagged behind everybody else. I believe that number is about 27%. In the second area we were interested in related to participation, the overall number, again, is in the 70s. So there's a lot of involvement from these municipal officials, but much less so from public health again. Variability with respect to job type and position, and it kind of plays out the way you might expect it to. But once again, public health had much less experience in this area. We did a series of models, looked at various factors, both in the overall sample as well as trying to understand differences between public health and other fields. First, in terms of the overall findings, I'll spare you some of the data details on this, but essentially what we found was that people who were more likely to have been working in land use policy participation, they were more likely to have sort of personal beliefs and experiences that related to this, thinking that it was important. So for example, a belief in the evidence. Coalitions and network participation was a really important predictor. And so we sort of have some sort of ancillary evidence that the coalition work can be effective. And we found that folks who were really interested in prioritizing things based on livability and that sort of thing were much more likely to be an active member or an active participant in land use policy. Some of the negative associations that we found, that is factors that were associated with being less likely to participate, were barriers related to staffing and inability to participate because of that, as well as perceptions of lack of collaboration across departments. The factors that were associated with transportation policy participation were quite similar. Again, the personal beliefs and participation in things like coalitions and networks were important, as well as a little bit different, prioritizing issues related to economic development and traffic congestion. And again, limited staff and lack of collaboration were key barriers. This particular slide here is a little busy, but I'll basically walk you through it. We were really trying to understand in this slide, what are some of the ways that we can approach the issue of physical activity, and how do we make it a priority for legislators? We know that the built environment can affect a lot of different things, and that environments that promote physical activity can also have a positive impact on things like economic development and safety and the health of vulnerable populations and climate change. And so this slide is showing the results of a latent class analysis that we did to try to get a handle on who cares about what. And what we found was 4 classes emerged. The first really prioritized economic development and revitalization and livability and smart growth. The second group that emerged was also concerned about economic development, but then as well, revitalization and traffic issues. The third was very much a health focus. And then the fourth class was the individuals who said that they cared about everything. And basically what we found when we tried to look at who falls into these sort of priority groups was that the class 4, the general folks who cared about everything, were really the mayors and the city councilors who said, yes, all of this is important. The class 3 folks were much more likely, the folks who said they care about public health and obesity and physical activity, were people who worked in public health and who worked in parks and recreation. The other folks, the class 1, class 2, who cared really about economic development and revitalization more than anything else, tended to be everybody else. The planners, the transportation folks, et cetera, fell into these categories. And so we thought that this was an interesting way to think about how we kind of target our messages or communicate with people across different disciplines. The last set of analysis that we did with this data was to try to understand a little bit more about where public health officials fell with respect to some of the exposure variables that we were interested in. As we saw before, their participation levels were much lower. And so it's by this point in sort of in our trajectory of analysis and working on this project, we're starting to lean towards thinking about maybe public health as an area that we could focus some of our future efforts on. And we found that public health officials obviously had much less experience with land use and transportation policy. While they believed it was physical activity in particular was a much more important part of their day-to-day activities, they believed also that it was less likely to be considered in built environment policy. They were more likely to participate in coalitions, although they were less likely to actually be involved in policy. And they experienced, importantly, some critical lack of perceptions around staffing and ability to participate in this kind of work, and perceptions of lack of collaboration or lack of experience, more likely, with collaboration across municipal departments. And so this last slide sort of leads us directly into the next study that we did in the first round of PAPRN. In this project, we reached out to collaborators at NACCHO, the National Association of County and City Health Officials, because it seemed like a great starting place to start to focus our efforts on local health departments. And we initiated a collaboration in which we did an analysis of the 2013 profile of local health department survey. So this is a survey that NACCHO does every couple of years. I'm not sure there's a standard schedule. And the goal of the survey is to, basically they survey every local health department, meaning city, county, any way that you configure a local health department below the state level. And in the cases of Rhode Island and Hawaii, where there is no local health department, the actual state health department. And their goal is to survey them on their activities in a very, very broad range of areas. And so there's a primary survey that targets everybody, and then there are a couple of supplemental surveys that are offered in addition that go to random samples. And as part of this survey, and part of one of the sub-surveys where they target about half of the local health departments through a probability sample, they ask about participation in policy and advocacy areas, including related to community level urban design and land use policies, as well as active transportation options. So these are two outcomes that were pretty similar to our first study, but they had access to a bigger and more representative sample of local health departments than we did. And we were interested first in understanding the prevalence and experience in working in these areas among local health departments, but we were also interested in how factors relate to them, including health department structural characteristics, how performance improvement efforts that are sort of popping up everywhere for, for strategic planning, et cetera, for health departments, as well as their experience with collaboration influenced whether or not they had been a part of built environment policy efforts. In terms of key findings, even though we had a different design and we had a lower response rate than they did, we found some similarities with respect to prevalence. Their numbers were actually a little lower than our first survey. They found that 25% of local health departments, any official in a local health department had participation in land use or community design policy activities, and only 16% had participated in anything that they envisioned as being related to active transportation options. With respect to what was associated with policy participation, it was really the big cities where this was happening. So the really large cities with more than 500,000 people, there was a pretty steep change in rates based on community size. Probably that's not very surprising to anybody on the call. We found that the coalition approach was also very effective, independent of population size. So again, being part of a coalition or a network was predictive, as was participation in the Community Health Improvement Plan in the past 5 years. For those who are not familiar, Community Health Improvement Planning is really an approach to strategic planning that is very community oriented and is advocated or actually required for public health accreditation. So we sort of view this as really a performance improvement type approach. With respect to transportation policy, the key things were fairly similar in that large populations and those who had involvement in some sort of a coalition or network were important predictors, as was greater staffing and consistent use of the community guide to drive their efforts. So similar to the land use policy, it's some attempts at really using evidence or a strategic improvement a strategic planning or performance improvement policy approach, excuse me. And so here we thought we had identified a few key things to be thinking about. One was really, we probably don't need to be reaching out to the really large cities because they seem to be doing better. But second, the idea that we could tap into the sort of flux of the movement towards using performance improvement approaches to guiding the work could be an important way to go. So by this point, we had reached, our 2014 application, and we decided to focus it specifically on local health departments with a goal of developing a research-based tool that identified core capabilities for local health departments and other public health entities to use in strategic planning. And the goal of this tool would be to assess where current activities fit into their current physical activity and built environment approach, and to strengthen capacity over time by outlining options for next steps. And critically, I think we sort of thought from the outset that it would be important to recognize the wide variability in configuration as well as resources of local health departments across the country. So we wanted to develop something that had some flexibility. Our approach to accomplishing this is to use a modified Delphi process. So a Delphi approach is pretty simply a methodological approach that is intended to gain consensus on an area, whether it be a set of recommendations, competencies, whatever it might be, that utilize experts in a given area and have them participate in a series of different methodologies to help achieve consensus on an area. And ultimately what we did was enroll a panel of experts from across the country to participate in 3 different rounds. The first was a series of key informant interviews, and we want to thank, first of all, our PAPRN Plus collaborators, because we identified the majority of our panel members through this network, which was wonderful. After we did the round 1 key informant interviews, the second methodology that we used was to synthesize the results from these interviews and put it into an online survey that I'll describe in detail in a few minutes. But ultimately what we did was we came up with this initial list of capabilities from the key informant interviews, along with tasks associated with each capability, and to take it out even further, associated knowledge and skill sets required to perform the tasks. We used the round 2 survey to ask respondents to rank them with respect to whether or not they felt that they were important and whether or not they felt that they were feasible. And then lastly, in our third round, we refined what we did in round 2 and completed a final validation survey. You can see from the other elements of this slide that we had representation from transportation, planning, health, advocacy, and administration. And we're talking about administration. What we mean by that are mayors and city councilors and managers, et cetera. After we did round 1, I just want to mention, because the numbers don't quite add up, we realized that we were kind of low on advocates and the administrative folks, so we supplemented the sample with a few additional people in round 2 before we move forward. The key informant interviews asked participants to respond separately for land use and transportation to these questions. How can local health departments help other municipal departments meet their own goals? What are the unique contributions that they can make? What roles or activities could they participate in? And what are the knowledge and skill sets required to accomplish this? I will also say that we started off these interviews first by saying, do you think this is a good idea? Is there value in local health departments participating? And overwhelmingly, the response was yes. So I'm not going to be presenting that data. But that was, in case anybody was wondering, one of the key things that came up first. After round 1, we ended up developing an initial set of capabilities, and the next few slides just kind of walk you through what those are and how we define them. So number 1 is collaboration with other officials, and this focuses on relationships with local, regional, and state governments, across sectors and as well as health departments. Number 2 is public outreach to the community, which can include community education, engagement, mobilization, and promotion. Number 3 is policymaker education, and this is accomplished to increase awareness and develop champions within the local government structure. Number 4 is review and comment on plans, policies, and projects, specifically that enhance walking and bicycling and transit access. Number 3 is the development of such plans and policies, and to be an active participant throughout the process. Number 6 is project development and design review, so input on project design from the early stages. Number 7, to serve on policy boards that relate to land use or transportation, whether this be in a voting or non-voting role. Number 8 came up pretty often, and it's something that I think that other officials equate with health department capabilities, and this relates to data and assessment, and this included a range of things from primary data collection to health impact assessment to GIS to qualitative work, et cetera. Number 9 was cross-sector and dedicated funding, and the idea there being, either embedding planning or transportation within local health department staff, or having staff within the health department be dedicated to these activities. And then the last one was funding support. So working collaboratively on grants, as well as potentially allocating existing funding or funding from other projects through grants to these areas. And so this is a very broad list. For each of these 10 areas, we additionally developed a series of related tasks. So what does it mean, for example, on the slide, when we say policymaker education, what are the tasks associated with that? And I'm just going to very briefly walk you through one example because it's far too much to present. And so with respect to policymaker education, 4 key tasks emerged. The first was communications and presentations to elected and appointed officials. The second was actually conducting trainings about built environment impact on physical activity and health to elected officials. Number 3 was trainings for land use and transportation staff, as well as their boards, so that they can become better educated about the impacts that their work can have on physical activity. And then lastly was to institute the built environment as a regular topic on their own internal health board agenda. So these are a variety of different things. And then for each of these different tasks, we went through the process of developing a series of knowledge and skill sets for each that may be required. And so this is, again, very detailed, but I just wanted to give you a sense of what we did. For each task, we broke it out by knowledge and skill, and the big categories under knowledge are knowledge of process, professional practice, laws and regulations, as well as data sources and tools. And then the big buckets of areas under skill sets are research, assessment, or quantitative skills, relationship development and management, again, the policy process and community engagement, and then lastly, spatial, which is not applicable here. And I won't read this to you, but it just gives you a sense that we were interested in sort of starting with general ideas and then trying to break it down, well, to what does this really look like in practice and what are we talking about as we move forward with this work. So after we did the first round of the Delphi process, we created a survey and we asked our same panel that was supplemented with a few additional individuals to first rank the 10 capabilities in terms of their perceptions. The first rank was on potential impact. So how important is this particular capability with respect to the impact that it could have on promoting, improved policy processes, et cetera. The second rating for each of the 10 capabilities was on feasibility, and that is how feasible do you think it is for a local health department to actually be able to participate in this. This slide shows you how they sort of mapped out on each other, impact by feasibility rankings. What we found was that there was a little bit of variability with respect to impact. Everything sort of clustered a little bit towards the middle. And we interpreted that to mean that there wasn't really a consensus, and we combined that with open-ended responses that we got from the survey participants, and our final interpretation of our working group of all of our collaborators was that really it seems like by and large people think that these are potentially important areas. Where there was more consensus was really in feasibility. And so there was clearly, you can see sort of cross-sector and dedicated funding was deemed to be the least feasible of all of these areas, whereas collaboration and working, across departments is the most feasible area. And so there's some face validity to the way that the results of feasibility laid out. What we ended up deciding as a sort of an investigative team was to keep all of these capabilities in our work moving forward, because it did seem like there was perceived importance of the different areas. But at this point, we made the decision that we would break it out by resource categorization. And so where we went to next was to categorize these areas by resources required. As I mentioned from the outset, one of our goals was to create something that could be used by departments of varying resource levels. And so we thought that this categorization process would help with that. And so our initial categorization is kind of laid out here. What you see on the right, though, are the percentages, are the results of our round 3 survey. We did a lot of things to validate in round 3, but I'm sharing with you just the results that ended up changing things. And we found that there was some disagreement with how we categorize things based on resources. And so we use this data to move us towards our final product, which I'm going to share with you just a few pages of now. And so ultimately, the culmination of all of this work is a tool that we're hoping will be finalized very soon. We're almost there, entitled Capabilities for Public Health Agency Involvement in Land Use and Transportation Decision Making to Increase Active Transportation Opportunity. And this is we're covering in this document both our capability areas and our task areas. We've decided to keep the specific skills and knowledge sets out of this particular document because it's just a little too busy and a little too much. And we'll talk more about where that's going in a few minutes. This next slide here just shows you visually, first of all, where everything kind of ended up in terms of resource categorization, but it gives you a little bit of a sense of what the document is going to look like. It's about, I think, about 20 pages overall, but you can see here that there was a little bit of change, and I believe we're still tweaking this. I think our final review of the document, the folks didn't like the little people running to indicate level of resources, and we're changing the color scheme a little bit. But basically, we're laying it out visually in a way that we hope is useful and appealing and can be used as a document to guide the strategic planning process. And we are right now at the point of finalizing this document and thinking through broad dissemination. With respect to our Delphi process, there are some strengths and limitations. The purposeful and snowball sampling methods and the small sample size do lead to, obviously some concerns about generalizability. However, we did have a really rich pool of expert panels who ended up participating, and they brought a wealth of experience, and we ended up with some really, really rich data. We had high integrator agreement through all of our methodological processes here, and it really builds, we think, on the literature moving forward. And so with respect to sort of concluding thoughts on this particular project, we've identified a core set of capabilities that provides a menu of options and recognizes that local health departments have varying levels of resources and expertise. In thinking about where this kind of fits into where local public health practice is today, it's consistent with the idea of Public Health 3.0, which calls for health officials to serve as chief health strategists for communities and is focused on cross-sector partnerships and collaboration. It's also consistent with the core functions of public health, which calls for public health departments to have engagement in policy-related activities. We view this document really as just a starting point for work moving forward. It provides a place to think about how to make strategic decisions about how to increase local health department capacity. And this is going to inform our next steps as we move more towards training and technical assistant intervention models to help build capacity. And so with respect to our next steps, where I think hopefully we can give another presentation in a year or so on, we are working with NACCHO right now on a national survey of local health departments. And the goal of the survey is to establish where health departments are nationally with respect to the work that we've developed. So where do they feel they stand right now with respect to each of the 10 capabilities and some associated factors. And we're also assessing their preferences for training and technical assistance models as we move forward in that direction. And then ultimately, so I'll mention that the survey is going to be going live into the field in June. So in just a couple weeks away, we'll be in the field, and we'll have that survey completed by the end of the summer. And then in year 4 and 5 in PAPRN, we're working on developing, pilot testing some training and technical assistance approaches for capacity building. And so with that, I include here some of the citations that we have from the work that we've done, and I'm happy to share this with you, and just, the requisite image credits. And I will leave it at that. So at this point, I'd like to open it up for questions or comments. I'm happy to hear from everyone.
Great. Thank you so much, Stephanie. What a great presentation. And you guys have been doing tremendous work. It's wonderful to sort of see everything point. I know I have several questions, but let me pause and see if somebody else wants to start for questions or comments for Stephanie and her team. All right, well then I'll go ahead and start with my question, Stephanie, if you don't mind. I had a clarifying question and then a separate question. My first clarifying question was, how did you sort of define participation, right? When people were asked about, did they participate in sort of land use policy, do you feel like, were you guys trying to capture some, what did you intend for participation to mean? Did people have a definition of that, or just wondering if you could talk a little bit about that, because I can imagine there's different levels of engagement.
There absolutely is different levels of engagement, and I think that's probably a limitation to some of the work that we've done. So we've really, I think, captured it in its most minimal format, in its most minimal form. We were not super clear. Karen, I believe, I'll ask Karen to step in. Our original survey that we did include levels of engagement, and I can't remember exactly what the wording was. So there were there was a scale that we used about participation, and I think we found that participation was so small that we went with, I guess, the least conservative approach of saying having any involvement at all meant that you have participated in the past. But I'll ask Karen to see if she can recall, because it's been a few years, exactly what those categories were. Karen, do you remember? Well, I'm happy to share that survey with you, Keisha, or anybody else who's interested. But to get to your point, you're absolutely right. There is wide variability in what participation can mean. It can be, minimal, or it can be heavy involvement. And I think by and large, what we found that the participation was more on the minimal side. But we did end up going with just sort of a dichotomous approach because of small numbers.
Yeah, great. Thank you for clarifying that. And then I was really struck and excited by your finding about one of the factors that was associated with both land use and transportation policy transportation policy was being involved in a coalition or network. I thought was really fascinating, and just wondering if you guys captured any additional information about, what types of coalitions, or did people sort of share that they were involved in, active living research or TRV or something. I wanted to know if you guys were able to dig a little bit deeper into that, because I thought that could be a good way for those of us who are interested in this area to engage more with folks.
So in these surveys, no, we didn't collect anything more than just that. There was, in the last round of PAPRN, I think at least one paper that came out around, what strong coalitions look like. And so I'd be happy, I think Karen probably was involved in some of those papers. I personally was not. So there is some data out there that's been developed by PAPRN that talks about what does it mean to have an effective physical activity, slash active transportation coalition. But that didn't emerge in this work. We just had pretty straightforward questions in the quantitative surveys.
Great, thank you.
Any other questions or thoughts?
I think there's a question on the chat box.
Oh, okay. Let me see if I can figure out how to work the chat box.
Let me just see if I can open this. See. Okay, let's see if I can make this bigger here. Let's see.
I have it up if you want me to read it.
Sure, that'd be great. Thank you.
Was there a disconnect between the jurisdiction of, sorry, I'm getting an echo. I hope you get as bad as I do. Was there a disconnect between the jurisdiction of local health departments and municipalities? Local health departments are often county jurisdiction with more to contend with in a particular city.
So that's a great question, and you're right, there's a lot of variability in how local health departments define themselves, even beyond just city and county. We did include that as a correlate in the second study that we did with NACHO to see if there was an association between type of, quote, local health department and participation, and we didn't find any such association. One of the limitations of our work is that, any involvement for a county official could mean just being involved in, the town or city that they're located, or just one. It could mean that they weren't necessarily working with it across the entire county, so we can't capture that. But in terms of the crude way in which we were able to capture it, we didn't find any differences.
Stephanie, this is Tom. I'm wondering if you could talk a little about the out years, your actual plans for training and maybe communities of practice, just where you see that might be going.
That's a great question. So our initial, the survey that we're putting into the field will drive that heavily. And so we're planning on doing a quantitative survey, and we're asking about what are the training and technical assistance preferences. And we included a range of options from, doing sort of ad hoc workshops at, the NACCHO conference or things like that, to actually developing more sophisticated online communities of practice to get a sense of whether or not health departments might be interested in being involved in these more potentially, I guess, time intensive and maybe even resource intensive approaches. And we're asking questions around level of financial commitment, et cetera. And so I think much of it is going to be driven by the data, and as well as where they see their limitations are in terms of capacity. I could potentially see, some of the capabilities may cluster together nicely. So there are several that are involved about the policy process itself. And they have to do with planning, implementing, et cetera. They're different capabilities, but the basic knowledge base behind it and skill set behind it has some similarities. So I guess I could see, one approach to training focusing just on that, whereas some of the other activities really cluster a little bit more around engagement, whether it be with policymakers or communities, et cetera. And so maybe there's another approach to sort of addressing those kinds of issues. I think that these capabilities are very broad, so it's hard for me to imagine like a quick and dirty, let's address all of these in one training. And based on the data, I think we may have to prioritize what we end up starting with in terms of training and technical assistance approaches. I'd love to see ultimately down the road being able to develop, sort of something that's online and that is building communities of practices, but we don't want to get too far ahead of ourselves, and we want to base it on what health departments say they're actually willing to commit to.
Okay, thanks.
Yes, please. May I ask
yes.
a question?
Yes. Please go ahead.
Just a short question regarding your slide on when you presented the modified Delphi process.
Yes.
One category of participants was advocacy. May I ask you who were these participants more precisely, please? Because I'm calling from France, and I'm just wondering what kind of participants was in this category.
Sure. So again, if Karen is on, I'll ask her to chime in without giving away anybody's names, because Karen was the one who actually did the interviews. But basically, there are folks who weren't necessarily, employees in local government who work in a capacity where their goal is to work for sort of a nonprofit that is dedicated to improving, walkability and bikeability. So they're usually walk bike advocates. And they came from a variety of different organization types. They tend to be the folks who are leading these large coalitions and networks, successfully.
Okay.
Did that answer your question?
Yes, but I was wondering what was the equivalent in France?
What is the equivalent in France?
Yeah.
I honestly don't know that I have an answer for that.
I understand, but that's why I asked this question.
Sure.
Thanks.
I mean, so here, building on Keisha's comment, I can tell you, here within our own city, and it's different in different places, there is a coalition actually that Karen leads, a walk bike coalition that is comprised of members of different community organizations, comprised of concerned citizens, but also comprised of some government officials who work together to develop a local agenda related to promoting policy.
Okay, so it's not people from the municipalities.
They may be a part of it, but the people who were part of our survey were not. No, they were not part of the
Okay.
municipalities. No.
Okay, thanks.
Stephanie, this is Keisha again. You, towards the end of your presentation, mentioned that you guys are starting to think about broad dissemination, and you'll be working on that over in the near future. Just wondering if you can share some of your initial thoughts on, you know, who are the key stakeholders that you're planning to share your findings with, and just a few thoughts on dissemination.
Sure. So, I mean, I think our primary target stakeholder group are local health departments, but I also think that others in municipal government and others who do this work are important stakeholders as well. And so the key product from this first phase is going to be this document that we've developed, and we will have accompanying you know, briefs and executive summaries, as well as a longer, sort of more technical manual that goes along with it. Two of our key partners to date have been NACCHO and Change Lab Solutions. So we're going to be working with them first to think about how we can distribute and share what we have done. And then we'll sort of take it from there. And so we do want to get the word out, but we also want to be clear that we recognize that just having a document in place is not necessarily going to change, you know, make you know, a lot of movement, you know, in the needle. So we're going to build from this document our future research efforts as well. And so we're going to focus primarily a practitioner targeted audience with the first emphasis on health departments, but also more broadly to the folks that we hope that health departments will improve their capacity to collaborate with.
Great, thank you. Are there any final questions for Stephanie? Let me check the chat box and also see if folks have any final questions.
I'd like to just give a public compliment to this whole body of work, and I know it's a large amount of labor that goes into it for the resources that we provide. So once again, thanks for both doing it and keeping it going.
Thank you, appreciate that.
Yeah, Tom, that's a great transition to my final comments. I just want to echo that, Stephanie, and thank you so much for making time to present today, and I hope that the questions that you received at the end were sort of helpful for you guys as you're continuing to move forward on this work, and really important, and let us know how we can support you in terms of continuing to get it out. Really great work. Kudos to your team.
Thank you.
And thanks everybody for being on today. I know we're just about out of time. Just wanted to check in and see if anybody has any updates or anything that they want to share for open mic. Okay. I'm not hearing anything. Let me remind people to please send us, if you have updates or position announcements or things for the field, send them to us, and we can get them out to the PAPRN Plus listserv, which has, you know, a few hundred people on it. Our final agenda item was the next meeting time, because we are scheduled to next meet in July, and a few people reached out to me and said that they'll be on holiday or are unable to attend. I just want to ask people to sort of be in touch if they think we should schedule that meeting or postpone it because of summer travel. If that's the case, then we will take a break for the summer and then resume our meetings in September. But of course, if something pressing is coming up, we want to find time to meet, particularly with things going on with the CDC budget. So, you know, please, this is Keisha, send me an email, KPOLLAC1 @jhu.edu, and let me know if you are going to be available for call in July, or if we should think about postponing that one or canceling that one and meeting in September. So once again, many thanks to all of you for calling in today. It's 2 o'clock, so let me wrap up and say we look forward to speaking with you again in the near future. Have a great day and enjoy the holiday weekend, and I hope it's a fun and active one. So take care.
Thanks.
Bye all.